Welcome. Today we're diving into a crucial topic affecting women's health: endometrial cancer. This informative video will cover everything you need to know about this disease, from its causes and symptoms to diagnosis, treatment, and prevention. Let's get started. Endometrial cancer, put simply, is cancer that begins in the lining of the uterus, known as the endometrium. While the exact cause isn't always clear, a few key factors are strongly linked to its development. The most prominent is prolonged exposure to estrogen without balancing progesterone. This can occur due to conditions like obesity, polycystic ovary syndrome (POS), estrogen-only hormone replacement therapy, and early menstruation or late menopause. Other risk factors include age, family history of endometrial, colon, or ovarian cancer, certain genetic mutations like Lynch syndrome, and previous radiation therapy to the pelvic area. Now let's talk about what's actually happening in the body. Endometrial cancer begins when cells in the endometrium develop changes or mutations in their DNA. These mutations cause cells to grow and multiply uncontrollably, forming a tumor. Over time, this tumor can invade deeper layers of the uterus and even spread to other parts of the body through the bloodstream or lymphatic system. The type of cancer cell also plays a role, influencing how quickly it grows and spreads. Most endometrial cancers are adenocarcinomas, meaning they develop from gland cells in the uterine lining. Endometrial cancer is the most common gynecologic malignancy in developed countries. It primarily affects women after menopause, with the average age at diagnosis being around 60. However, it can occur in younger women, particularly those with the risk factors we mentioned earlier, like obesity or PCOS. Statistics show a rising incidence of endometrial cancer in some regions, possibly due to increasing obesity rates and longer lifespans. Understanding the epidemiology helps us better identify at-risk populations and implement effective screening and prevention strategies. Early detection is key when it comes to endometrial cancer, and recognizing the signs and symptoms is crucial. The most common symptom is abnormal vaginal bleeding, which can present as spotting, bleeding between periods, or heavier or longer periods. Postmenopausal bleeding, even just a small amount, should always be investigated. Other symptoms might include pelvic pain or pressure, difficulty urinating, and unexplained weight loss. If you experience any of these symptoms, especially abnormal bleeding, it's essential to consult your doctor promptly. If you're experiencing symptoms suggestive of endometrial cancer, your doctor will conduct a thorough evaluation. This typically includes a pelvic exam to assess the uterus and surrounding structures. The most definitive diagnostic procedure is an endometrial biopsy, where a small sample of the uterine lining is taken and examined under a microscope. In some cases, a dilation and curettage (D&C) may be performed to obtain a larger tissue sample. Imaging tests such as transvaginal ultrasound, CT scans, or MRI can help determine the extent of the cancer and whether it has spread beyond the uterus. Endometrial cancers are classified based on several factors, including the type of cancer cells, how abnormal they look under a microscopic grade, and how far the cancer has spread stage. The most common type is endometrioid adenocarcinoma. Other less common types include serous carcinoma, clear cell carcinoma, and carcinosarcoma. Staging is crucial for determining the best treatment approach. Stage I means the cancer is only in the uterus, while stage IV indicates that it has spread to distant organs. The grade reflects how aggressive the cancer cells appear to be. The treatment for endometrial cancer typically involves a combination of approaches, tailored to the individual patient and the stage and grade of the cancer. Surgery is usually the primary treatment, involving a hysterectomy, removal of the uterus, and often removal of the ovaries and fallopian tubes, a salpingo, oophorectomy. Lymph nodes may also be removed to check for cancer spread. Radiation therapy, either external beam radiation or brachytherapies, internal radiation, may be used to kill any remaining cancer cells after surgery or in cases where surgery isn't possible. Chemotherapy may be used to treat more advanced stages of cancer or if the cancer has spread. Hormone therapy, using progestins, is sometimes used for certain types of endometrial cancer or to manage recurrence. While it's not possible to completely eliminate the risk of endometrial cancer, there are steps you can take to reduce your risk. Maintaining a healthy weight is crucial, as obesity is a major risk factor. Regular exercise and a balanced diet can help. If you're taking hormone replacement therapy, discuss the risks and benefits with your doctor, especially the use of estrogen-only therapy. Women with a family history of endometrial, colon, or ovarian cancer should consider genetic counseling and screening. Regular checkups with your gynecologist are essential for early detection and prevention. The prognosis for endometrial cancer is generally good, especially when it's diagnosed at an early stage. Most women with stage I cancer are cured with surgery alone. the prognosis becomes less favorable as the stage advances. Ongoing research is focused on developing new and more effective treatments, including targeted therapies that target specific molecules in cancer cells and immunotherapies that harness the power of the immune system to fight cancer. These advances offer hope for improved outcomes for women with advanced or recurrent endometrial cancer.
Thanks for watching!